In your CPT book, don't forget, everything we do in CPT is done in a fashion that lays out the services that are provided to that patient. Yesterday, we talked about these a little bit, so I'm just going to go through those again briefly. Your sections in CPT are introduction, evaluation and management, anesthesia, surgery, radiology, path and lab medicine, category 2 and 3, appendices, and your index. Don't forget your guidelines in every section of CPT to help you understand those services that you are now going to supply to your patients. You have brand new language in your CPT books. And if you look in CPT, you will find that there is the same thing we looked and discovered yesterday. You have green writing in CPT in 2009 that says, here are some changes to the guidelines, and here's a quick, fast way to reference those changes. And that is to find that green language that is in your E&M guidelines. So if I'm looking at my CPT book, and I would encourage a lot of you or all of you to kind of follow along both in your CPT books and in your workbook as we go through some of the things in the evaluation and management guidelines. And we're going to take a pretty deep dive into this a little bit later. We're going to do an overview first, and then we're going to do a deep dive. But the language change in 2009 is important for us to look at. So look at page 1 of your CPT book. On page 1, you have a category called Definitions of Commonly Used Terms. And you'll see a green diamond there that says this is this is new language for your E&M guidelines in 2009. So let's see what that means. What does that say to us? Well, certain keywords and phrases are used throughout your E&M section. The following definitions are intended to reduce the potential for differing interpretations and to increase the consistency of reporting by physicians in differing specialties. E&M services may also be reported by other qualified healthcare professionals. Again, we talked about that a little bit yesterday. There is a reference to people that provide services to your patients other than physicians, who are authorized to perform such services within the scope of their practice. So what are we talking about? Well, we're talking about nurse practitioners, PAs, or certified nursing specialists. Those are an example of those qualified healthcare professionals. So don't forget, you want to always check what can that qualified healthcare professional provide. And how do we know that? You want to go to the licensing board in the state in which they practice, and you want to make sure that they are practicing within the scope of their practice.